My name is Mr. Babs, and this is my personal account of how Optimax ruined my life. I had worn glasses since an early age and jumped at the chance to get rid of them. On the 10th of June 2011, I made what was possibly the worst decision of my life when I walked into the Optimax clinic in Finchley Road. The Optimax salesman told me there was absolutely no risks, just the guarantee of a life-changing experience. It was certainly that. After my consultation, a number of eye tests were performed by office staff who worked on the reception desk, not by a surgeon, nor even an optometrist. I didn't even meet the surgeon until half an hour before surgery. I had waited 10 years before making the decision to go ahead with laser surgery, allowing technology more time to improve from its earlier days. Following surgery, I really did experience the wow factor. I was able to see for the first time in my adult life without depending on glasses. But by August of 2011, focusing beyond 20 meters was getting difficult. I didn't even worry about it, as various optometrists at Optimax had told me my eyes were still in the healing stages. By September, however, I started to be concerned. Red rings appeared around my eyelids and my eyes felt chronically dry and gritty. And I would suffer this for hours and hours. By December, I was really worried, having also developed an unbearable sensitivity to light. I went back to Optimax, and an arrogant and rude optometrist repeatedly told me that there was nothing wrong, just to keep using the refresh drops. I questioned the red rings, but she showed no interest, and out the door I went. By January of 2012, my vision had deteriorated significantly, and I was seeing starbursts from all lights in both day and night time. Having lost faith in Optimax, I went to my GP, who referred me to an NHS specialist. The consultant agreed that my eyes were in a very bad state. She said the NHS equipment couldn't compare to that of a specialist laser surgeons and advised I needed to be examined by one of them. In the meantime, she gave me a 4-week course of steroids, antibiotics for 3 months, Optiv eye drops prescribed for life, and a liquid-based gel for night time. I also had plugs inserted into my eyes to help with dryness permanently. So far, I have spent approximately £350 on assorted medication necessary for my eyes, for problems I did not have before allowing an incompetent doctor to perform LASIK eye surgery on my priceless eyes. With the help of My Beautiful Eyes, the campaign group demanding government legislation, I recently met with Optimax's medical director, Dr. Malcolm Samuel. I insisted that Optimax pay for me to see a surgeon of my choosing for an independent consultation elsewhere. They agreed. On the 20th of July, I was examined by renowned surgeon Shiraz Daya at the Centre for Sight Clinic in London. His findings showed that I had lots of high-order aberrations, accounting for my starbursts. Also, the laser treatment I'd received at Optimax had smallish zones of treatment and one was decentered. In layman's terms, imagine a circle target. It's possible the laser had missed the target and hit the area outside and above the circle. I saw the scan clearly showing where it should have been. This, besides my other problems, I was in shock, soon followed by anger. My eyes have been damaged thanks to either a fault with the Nidec laser machine or due to the incompetence and negligence of Dr. Sithapa Madhusudan. I am now intending to take legal action and seek financial compensation from Russell Ambrose, owner of Optimax. But even so, I will have to live with this depressing and debilitating side effects for the rest of my life, and no amount of money can make up for that. I will always live in regret of walking through the doors of Optimax UK for the rest of my life. I advise anyone else with these problems, please contact me for details of where they can get help and advice. Do not take any notice of the 41-point consent form you signed. If your eyes are damaged, you can take legal action. Thank you for listening.